Hey everyone, my name is Himani Modi, and here's the topic for my research proposal. We'll be discussing today whether occupational therapy is effective for patients diagnosed with chronic obstructive pulmonary disease. So the main purpose of this study is to determine whether current occupational therapy interventions have a positive impact on patients diagnosed with COPD. Another important purpose is to determine the best ways to conduct research for this population to obtain statistically significant results that would be helpful at improving and expanding OT methods for patients with this diagnosis. So what is COPD? The acronym stands for Chronic Obstructive Pulmonary Disease. COPD involves a group of inflammatory lung diseases that block airflow and make it difficult to breathe. The most common conditions that make up COPD include emphysema and chronic bronchitis. This is a diagnosis that doesn't have a cure. However, symptoms are manageable with proper care and therapy. The main symptoms involved with this diagnosis include breathing difficulty, cough, mucus production, and wheezing. I'm sure you're wondering, well, if there isn't a cure, what helps this condition? There are several occupational therapy interventions that are currently used to help improve the symptoms of COPD. Through most of the literature research that I did, the most common intervention strategies used were energy conservation techniques to improve activity tolerance for ADLs and IADLs. Adaptive equipment or devices with home modifications is another important strategy used taught to COPD patients to adapt their living environment to their condition. COPD patients are frequently taught breathing techniques through pursed lip breathing or diaphragmatic techniques in order to improve oxygen intake. Lastly, another common OT intervention is to give therapeutic exercises to COPD patients in order to increase activity tolerance overall. So the main issue that I ran into with this topic is that most of the research already done resulted in statistically insignificant findings due to a low number of participants or poor research design. This made it really difficult for me to differentiate effectiveness between different intervention strategies due to a lack of significant data on the subject. Although many occupational therapy professionals would state the opposite, many studies done on COPD patients have found that occupational therapy has no significant impact on its patients. So I conducted a literature review, and I felt it was very helpful to find all the different intervention strategies that other researchers used during their studies for patients with COPD. Additionally, reviewing these literature studies done by other researchers made it easier to decide what kind of research design that I wanted to go with for my research. This literature review made it clear that more research needs to be done on COPD patients getting occupational therapy treatment to prove the positive impact that OT can have on its patients with COPD. So I did want to go over a couple studies that I found while doing my research and my literature review. So this first study is called The Effect of Occupational Therapy in Patients with Chronic Obstructive Pulmonary Disease, a randomized control trial. So this study was directly correlated to my topic, and the main aim was to evaluate the effect OT had on patients with COPD. This was a randomized controlled trial done in Norwegia with 52 patients. Unfortunately, results found that the OT intervention did not improve occupational performance or satisfaction through the COPM. Researchers felt that the study needed more OT sessions and a larger pool of participants to have more successful results. Here's a second study that I also found. This one's called Benefits and Harms of Exercise Therapy in People with Multimorbidity, a Systematic Review and Meta-Analysis of Randomized Controlled Trials. So this study wasn't focused on only patients with COPD. However, there were COPD patients involved within the participant pool. The main aim of this meta-analysis was to investigate the benefits and harms of exercise therapy on patients with multimorbidities. So this study used interventions like Tai Chi, strengthening exercises, aerobic exercises, and a combination option with all of these involved. And they were done in various settings as well. So although this study determined that exercise therapy does decrease the number of hospitalizations and deaths, it doesn't specify which interventions would be most effective, which made it difficult for what my topic was on, even though it did state that these individuals benefited from occupational therapy. It was hard for me to find ways to figure out which of these intervention strategies were the most effective. So this slide is going over my research outline with its methods and procedures. So the sample size will be small, anywhere from 10 to 15 participants is the aim. For inclusion criteria, the individuals must be in a stable phase of the diagnosis. They should be younger than 80 years old. Participants should be able to speak and understand English and require 2 liters or less of oxygen. And this is just to ensure that all the participants are able to follow through with the study and participate with no limitations. So the instrument used during the study will be the Human Activity Profile Test. It will be administered to measure physical activity and energy equivalence and is a questionnaire specifically designed for COPD patients. The test takes less than 15 minutes and only requires pen and paper. The results of the MET levels and dyspnea levels from the HAP test will be compared at pre-test, post-test, and at follow-up. So the data will be kept after the study is done, but it will be kept locked away in a file cabinet safely for future research. Any names or anything that's identifiable will be removed so that participants can remain anonymous. The main source of error or limitation in this research design would be recall bias, mainly due to the fact that the HAP test is a patient-reported questionnaire, which could lead to some inaccuracies. This slide goes into even further detail, breaking down the schedule and going over details of the initial meetup, where participants will be debriefed on the rest of the study. So as you can see, the initial meetup date is on January 15th, 2024, and that will be a longer meetup just due to the fact that we're doing everything, we're doing the introduction, the test for the first time, and then also an intervention session. The sessions will occur monthly, so there will be one in each month up until September, which will be the last monthly meeting. And then we will have a 6-month follow-up in March, on March 15, 2025, just to see how everybody's doing and how the effect that, the study left on all the participants. So I wanted to go into the intervention sessions a little bit. The intervention sessions will consist of 4 main occupational therapy strategies that I found during my literature review. That includes the breathing techniques, the adaptive equipment or assistive devices, therapeutic exercises, and of course the energy conservation techniques. So the type of intervention that participants receive will rotate each time they come to Robert Wood Johnson Hospital for their sessions. There's a total of 8 intervention sessions, with each participant receiving each type of intervention twice. So we'll definitely go over lip breathing, diaphragmatic breathing, any rollators or scooters that they could benefit from, walkers, CPAP machines. Going over exercises, there would definitely be a combination of muscle strengthening, aerobic exercises, and Tai Chi or yoga. And the energy conservation techniques will cover planning ahead, being able to pace yourself during activities that you do daily, and proper positioning that would be helpful during any activities that the individual does. So why this project should receive funding? COPD affects millions of people worldwide. And for most, the diagnosis results in many hospital visits and treatments necessary to manage the condition and its symptoms. Since COVID, there has been a rise in respiratory infections and diseases, with many individuals reporting longer-lasting effects from lung-related sickness. More and more individuals are being admitted to medical facilities for respiratory infections than ever before. So it is vital to provide funding for the necessary research of this population to do what we can as occupational therapists to ease the burden on individuals with COPD and provide them with the care that we know will be most successful and most effective. So yeah, and these are my references. Thank you so much for listening to my research project. I really enjoyed learning more about this topic and learning how I would conduct my own research project in the future. Occupational therapy is an evidence-based practice, and research is a huge part of ensuring that it continues to provide interventions that are proven to be successful for its patients. Thank you again.